is Agence France Presse, Nina Larsson. Nina.
Yeah, hi, and thanks for taking my question. I wanted to ask you, I see that, sorry, I'm just trying to pull up my question here. I see that US President Donald Trump said earlier today that he believes China's coronavirus total is far higher than admitted. And this came after the Wuhan revised up its death toll by 50%. I was just wondering how confident WHO is in the numbers you've currently been provided by China, and what ability do you have to actually verify them? Thank you very much.
So I'll start, and perhaps Mike or Gigi would like to supplement. So we are aware of new numbers that were reported overnight from China, which added an additional 325 cases and 1,290 deaths from Wuhan. And this was done in an attempt to leave no case undocumented. What we understand is that they've used an existing law of statistics to find these cases. And what they did is they reviewed different databases. They looked at the database that is kept for all of the confirmed cases. They looked at their funeral service systems. They looked at hospital systems. They looked at laboratories to see if there were any duplications or if there were any cases missing. They looked for cases in fever clinics and hospitals, detention centers, and elderly care centers as well. And what they have reported is that the discrepancies in these cases were due to a number of factors. First is that the healthcare system in Wuhan was overwhelmed at one point, and some patients died at home. Secondly, is that medical staff were delayed in reporting of these cases because they were focused on providing care for those patients and they didn't fill out the forms in time. Next is that there were additional locations that were built. And if you remember, in Wuhan in particular, some of the hospitals themselves were overwhelmed. And so they set up these makeshift hospitals that they called them, which were essentially stadiums and other facilities where they put mild cases to be cared for. And in those situations, the reporting wasn't done in a timely manner. And so those cases were added. And in some situations, the reports weren't filled in completely. And so what they did is they did a review of that and they revised their numbers, and those were the numbers that were updated overnight. It is very important to know the numbers of people who have died from COVID-19 because this is of public health importance. And it is important that we have the accurate reporting of this. And in such, WHO has developed some guidance around this, which is for their international guidelines for certification and classification of COVID-19 as a cause of death. And this is based on ICD codes that exist. And our primary goal is to support countries in their ability to classify people who have died from COVID-19. And I just want to say that this is something that is a challenge in an ongoing outbreak, to identify all of your cases and to identify all of the deaths as an outbreak happens, especially if systems are overwhelmed. I would anticipate that many countries are going to be in a similar situation where they will have to go back and review records and look to see, did we capture all of them? I've seen a number of reports from media where people have been in a number of different countries where people have died outside of a hospital system. And so it will take some time for those individuals to be classified. So it is important that cases that do die from COVID-19 are recorded, and we've provided some guidance to support countries to do so.
Thank you, Maria, and thank you for the clarifications there. But we would also like countries to be as fast as possible in that process. And I know that it's somewhat forensic to go through these processes, and everyone wants to be sure. But it's really important that we understand the size and scale of the pandemic as it moves forward, and the use of a probable case definition or others where you can, in a sense, say, yes, this was probably a COVID-19 case is better. I would commend the authorities in New York, for example, who've announced a list of, or a number of probable deaths, which gives a much better sense of the impact of the epidemic. And it's that kind of speed with doing that. Those numbers may change over time, but I think it's always better when people put forward the data that they have as early as possible, because that keeps us on top of what the impact is and allows us to project forward in a much more accurate way. So I think, as Maria said, all countries will face this, but I do think, you know, it's important that countries provide that data as quickly as they can in the interests of moving our collective efforts forward to control this pandemic.